Hello, and welcome to today's video on a critical senior health issue, heart disease. It remains a leading killer, particularly in this age group. We'll cover what heart disease is, its warning signs, and how to prevent it. Let's begin. Section 1. Definition of heart disease. Heart disease encompasses various conditions of the heart, including coronary artery disease, heart attack, heart failure, and arrhythmia. Damaging the heart or the blood vessels can disrupt the supply of blood and oxygen, leading to a multitude of symptoms and ailments. The most common heart disease among older adults is coronary artery disease (CAD) from narrowed or clogged arteries with plaque. Plaque is made up of fat, cholesterol, and other substances found in the blood. Additional plaque restricts the blood vessels, resulting in chest pain, angina, or heart attack. Section 2. Senior heart disease. Cause heart disease can happen to anyone, but it is more common in the elderly because of a number of risk factors. The following are some common risk factors of heart disease in the elderly. 1. As age advances, the risk of heart disease rises. Arteries harden and the heart is able to circulate blood less effectively. 2. High blood pressure. Hypertension. High blood pressure is a major risk factor for heart disease. It can damage arteries, causing heart disease and stroke. 3. High cholesterol. Peak from high cholesterol is a risk to heart attacks and strokes. The elderly are at higher risk because of diet, lack of exercise, or heredity. 4. Diabetes. Diabetics can develop heart disease if blood sugar is not managed. High blood sugar levels ultimately destroy blood vessels and the heart. 5. Family background. Genetics are a significant factor in heart disease. If there is a history of heart problems in your family, you are at risk. 6. Lifestyle. Heavy alcohol consumption, poor diet, and physical inactivity all increase your risk of heart disease. Quitting those habits will lower your risk. Section 3. Early heart disease. Warning signs. In older adults, heart disease usually develops over a period of many years, without clear early warning signs. Nevertheless, certain warning signs do indicate heart ailment. One should take note of these signs and consult a doctor if you experience any. 1. Chest pain. Angina. Pain or discomfort in the chest is the most common initial symptom of heart disease, which is felt as pressure, tightness, or heaviness. It may vary and can be caused by exertion or stress. 2. Shortness of breath. Breathless may be a sign of poor blood flow from your heart, even when you are at rest. 3. Fatigue. Fatigue after adequate sleep can be a sign of heart disease. When the heart is unable to pump, the body receives less oxygen, which causes fatigue. 4. Dizziness or lightheaded. Kinesthesia. Fainting or mild headaches occur if the heart is struggling to supply blood to the brain, indicating a potential heart condition. 5. Swelling of legs, ankles, or feet. Swelling in legs and feet may be an indicator of ineffective heart function. Engorged veins cause the body to retain additional water, which leads to swelling. Section 4. Heart disease prevention. In the elderly, you can prevent heart disease for the most part by addressing risk factors prematurely. Lifestyle changes significantly lower your risk. 1. Eat a heart-healthy diet. Eating fruits, vegetables, whole grains, lean protein, and healthy fats lowers risk of heart disease. Saturated fat, processed food, and added sugar should be limited. Omega-3 fatty acids in fatty fish and flax seeds protect your heart. 2. Daily exercise. One of the best ways to take care of your heart is exercise. Try to do at least 30 minutes most days of the week. Swimming, walking, and cycling are great activities for older people. 3. Monitor blood pressure. Monitoring of blood pressure is crucial for cardiovascular health. Lifestyle changes such as decreased salt intake, physical activity, and stress control can maintain normal levels. 4. Control cholesterol. Cholesterol increases the risk of plaque in arteries. Reduce saturated fat, maintain a healthy weight, and use cholesterol-reducing medications if recommended by your physician. 5. Quit smoking. Smoking greatly accelerates heart disease risk. To best safeguard your heart, stop smoking. Receive counseling or smoking cessation programs. 6. Limit alcohol consumption. Excessive alcohol can raise blood pressure and cause heart disease. Use alcohol in moderation. No more than 1 drink per day for women and 2 drinks per day for men. 7. Manage stress. Stress can cause long-term cardiac issues by elevating blood pressure and encouraging habits such as smoking and overeating. Adopt stress-reducing habits such as yoga, meditation, or slow breathing to manage stress. 8. Control diabetic blood sugar. If you have diabetes, monitor your doctor's food, activity, and medicine recommendations to lower heart disease risk. Section 5. Treatment options for heart disease in the elder life. You do have heart disease. It's helpful to know there are many different treatments available. The treatment you receive will be based on what kind and how serious your condition is. 1. Substance. Most heart disease drugs are statins to lower cholesterol. Beta blockers lower blood pressure and heart rate. ACE inhibitors widen blood vessels and boost heart function. Diuretics decrease the retention of fluids. Blood thinners prevent clots and reduce the risk of stroke. 2. Surgery. Surgery may be needed to correct heart disease. CABG, angioplasty, or stent insertion are procedures that can open clogged arteries and restore blood flow to the heart. 3. Lifestyle change. After a diagnosis of heart disease, lifestyle change is essential. A heart-healthy diet, exercise, and stress reduction can enhance health and minimize risk of complications. 4. Cardiac rehab. Cardiac rehabilitation programs assist heart disease patients in their recovery and in the improvement of heart health. They provide supervised exercise, education, and assistance in the management of the condition. Summary. Heart disease significantly affects the elderly. However, with proper information, lifestyle changes, and medical help, one can prevent, manage, or even reverse its effects. Knowing the risk factors, early symptoms, and necessary treatments is crucial in maintaining a healthy heart with aging. If you or a loved one is concerned about heart disease, talk to a health professional. Maintaining a healthy heart leads to a longer, healthier life. Thank you for watching. If this helped, like, subscribe, and share. Stay healthy, and God bless.